Myself, Dr. Radhika Karia, Assistant Professor, Harivandana Physiotherapy College, આપ સર્વેનું હાર્દિક સ્વાગત કરું છું. આજના આપણા વેબિનારનું ટાઇટલ છે Ergonomic Care for Computer Operator. હવે before starting with the topic, આપણે ટર્મિનોલોજી તો ખ્યાલ હોવી જ જોઈએ, રાઈટ? તો what is ergonomics? What is the importance of ergonomics in the daily life? તો પહેલા તો ergonomics શું છે એ સમજશું અને એનું ઇમ્પોર્ટન્સ શું છે એ સમજશું. ergonomics એટલે to fit yourself according to your workstation. તમારા વર્કસ્ટેશન માટે તમે કેટલા ફિટ છો એ રીતે તમારું વર્કસ્ટેશનને ડિઝાઇન કરો અકોર્ડિંગ ટુ યોર body habits, according to your body structure. We can set or we can modify our workstation, and by this way we can reduce the chances of the musculoskeletal disorders. Again question will arise, what is musculoskeletal disorder? એટલે કે સાંધા કે સ્નાયુની વીકનેસના લીધે થતા દુખાવા અને ડિસીઝ. તો પર્ટિક્યુલરલી વર્કસ્ટેશનને લગતા એટલે કે ઓક્યુપેશનને લગતા ઇલનેસનું લિસ્ટ. તો જેમ કે ફાર્મર્સ છે તો ફાર્મર્સને થતા હશે બેક પેઇન, એની નીચે જોઈને વર્ક કરવાનું થતું હોય. એટલે ટીચર્સ છે તો એને આ રીતે બોર્ડ વર્ક થતું હોય તો એને શોલ્ડર પેઇન, નેક પેઇન થવાના ચાન્સીસ. સેમ લાઈક કમ્પ્યુટર ઓપરેટરમાં નેક પેન, શોલ્ડર પેઇન, કન્ટિન્યુઅસ ટાઈપિંગ કરીને ફિંગર પેઇન એ રીતે થતું હોય છે, રિસ્ટ પેઇન થતું હોય છે. સો by providing the ergonomically correct workstation, we can reduce the chances of musculoskeletal disorders and various joint pain. So, what is ergonomics? Ergonomics is a study of work and the physical work environment. मतलब study related to your work, એનું study અને plus તમારા work setup નું study. By changing your workstation, we can reduce the musculoskeletal disorder. Now again question will arise, why such ergonomically correct workstation is important? And ergonomically correct workstation will help to prevent body injuries that occurs over a time due to the poor posture, repeated motions, poor workstation design or improper lifting. बात करिए આપણે computer operator ની. Here you can see the computer operator which is working by forwarding their neck like this. The neck નો forward movement થશે which will give continuous stress over this area, and that may leads to a neck pain or the shoulder pain, results into this neck pain, shoulder pain or back pain. So for that, for reducing the musculoskeletal disorder, it is advisable to have a correct or specifically ergonomically designed workstation. If we don't have a such kind of the workstation, like ergonomically correct workstation, that may result into the cumulative trauma disorders, repetitive strain injuries, musculoskeletal disorder. So all are same terminology. The disease or illness or weakness which results from your workstation because of the continuous physical work, which results into the MSD, that is known as musculoskeletal disorders. How serious this musculoskeletal disorder? So 1 in 3 of all lost day injuries each year that have a loss of 15 to 20 billions in a worker, which compensate each year. So it is a great loss secondary to the occupational illness. How these musculoskeletal disorders are developed? What are the risk factors for developing this musculoskeletal disorder? In that, repetitive or prolonged activities. કોઈ particular activity ને prolonged time માટે કરવામાં આવે તો particular group of the muscle. For example, typing activity for the computer operator. To type કરવા માટે your wrist and the finger muscles has to work continuously. So one group of the muscle has to work for the prolonged period of the time, that is repetitive and prolonged activity, which may result into the MSD, that is musculoskeletal disorder. It may result from the awkward posture, poor postural habits. You have seen that children are watching TV like this way, sitting by keeping your neck forwardly lean. So they may have a chances to develop the neck pain. Same like for the computer operator, if they assume a posture like slouch posture, anteriorly lean posture for a prolonged period of the time, or static posture for a prolonged period of the time that may result into the musculoskeletal disorder. Secondarily, high and low temperature. બધાએ ફેસ કર્યું હશે કે એસી હોય, નોર્મલ રૂમ ટેમ્પરેચર હોય તો તમારી વર્ક એફિશિયન્સી વધારે હોય કમ્પેર ટુ હ્યુમિડ ઓર ધ ગરમ ટેમ્પરેચર. સો ધ વાઇબ્રેશન, ફોર્સફુલ એક્સર્શન વધારે ફોર્સલી કરવામાં આવે તો that may result into the musculoskeletal disorders. According to one research, they have concluded that all the musculoskeletal disorder in that 70% of musculoskeletal disorders are results from the occupational illness. What do you mean by occupational illness? Occupation matlab your work or physical work, your demand. Matlab computer operator has to work over a computer for a longer period of the time. So because of that occupation, they develop certain kind of the illness. That is a occupational illness. So in total musculoskeletal disorders, 70% of musculoskeletal disorders are results from the occupational illness. So that secondary leads to ergonomically stressed area that are the back, shoulder, eyes, your neck region, elbow joint, wrist joint, hand. We can say hand, kandu, koni, ખભાનો હાડકું અને બેક એટલે કે તમારા કમરના આટલા દુખાવા. These are the common stress areas for the computer operator results from their occupational illness. What are the common causes to develop the musculoskeletal disorders? It includes repetitive motion, forceful motion, awkward posture. Repetitive motion in the sense continuous typing for a prolonged period of time from the one particular group of the or one particular joint. Demand from the one particular joint. Along with that, awkward posture. You are doing your work with awkward posture. As we discussed earlier, like anteriorly slouch, मतलब forwardly તમે bend થઈને work કરો કે વધારે backward lean થઈને work કરો. That may result into MSD, that is musculoskeletal disorder. Along with that, vibrations and extreme of the temperature may affect your work performance. Ultimately, what is the aim to design the correct ergonomically workstation to improve your work efficiency, to gain to reduce the chances of musculoskeletal disorder. With lesser time, you can produce a higher amount of the work. What are the risk factors to develop the MSD secondary to the occupational illness in a computer operator? Keying for a longer period of the time without break or the rest. Typing work કરતા હોય તો એને keying or typing activity longer period માટે કરવામાં આવે without rest કરશે તો but obvious છે that એક ટાઈમ આવશે ત્યારે તમારા આ બધા સાંધા ઘસાવાના સ્ટાર્ટ થશે, right? Using a force when striking the keyboard. ઘણાને હેબિટ હશે forcefully strike કરવાની. This work can be done with a lesser amount of the force too. So unnecessary force production or the higher grip may result into the development of the stress over your fingers and the use joint which is stress under the conditions. Working with the awkward neck, shoulder and elbow, wrist and back posture may result into the musculoskeletal disorder. Remains in a same position as we discussed, તમારી રીતે computer પર read કરતા હોય or else type કરતા હોય or else forward posture કરતા હોય. These are the certain postures assumed by the computer operators, or we can say they have a habit to walk like this. પછી તમારું લેપટોપ આ રીતે હશે અને તમે વર્ક કરતા હશો laterally sitting position. So it needs to have a stretch your body towards your laptop or towards your screen. So these are the certain risk factors which will develop which can develop the workstation. The disease results from the poor ergonomically designed stations. How we can change the workstation? We have two techniques, either with the standard way or with the innovative way. Standard way मतलब તમારું સ્ક્રીન છે, તમારું ટેબલ છે, એની હાઇટ તમારી રિક્વાયરમેન્ટ હાઇટ કરતાં વધારે છે તો just change your table or adjust your table. That is a standard. What is innovative way? अगर તમારા ટેબલની હાઇટ ઓછી છે so you can put a block over the leg of the table and you can increase the height of the table. So in an innovative way you can modify with the different ideas for your workstation design. So we can change our workstation with the two ways, either with the standard way or with the innovative way. These are the certain parameters, these are the common parameters which can alter for the ergonomically correct design posture. It includes here the back support angle, the depth of the seat, the height of the seat, the distance from the seat એટલે કે chair અને table વચ્ચેનું distance, the height of the table, the depth and the we can say depth of the table and the height of the monitor screen. These are the common parameters we can adjust to fit our computer operator for that workstation. Next is these are the certain tricks or we can say certain ideas to modify your workstation in an innovative way. Matlab, according to the handedness. If you are right-handed person, keep your mouse towards the right side. If you are left-handed person, તો તમારું માઉસને લેફ્ટ સાઈડ પ્લેસ કરો. તમારે અલોંગ વિથ યોર ઓફિસ વર્ક કમ્પ્યુટર સાથે તમારે પેન અને પેજ પર વર્ક કરવાનું થાય તો કીપ યોર book and the pen over the right side and keep if you are left-handed person keep your pen book mouse set your workstation to the left side to fit according to the handedness. Next is the sitting. For the sitting, for the ideal sitting posture, we need to check from the head position to the fit position. It should be supported and the correctly designed. First position is this. In that first figure shows that your head, shoulder and the hip should be in a one vertical line. This is the ideal sitting arrangement for the computer operators. In a second image you can see that our shoulder and the hip is in not line. मतलब તમારું back support છે થોડું વધારે પડતું આગળ છે which may create a stress over the shoulder and the back areas. In a third image we can see that our back is slant. પાછળની side slant હશે as like in a movie. So that is a relaxed posture. It is not advisable for the movie or the other side of area, right? Next is a back support. હવે તમારું back support કેવું હોય છે તો back support has to have a some curve along as per your back curvature. તમારું back નું curvature છે એ according તમારું back નું seat નું curvature set થવું જોઈએ. Then and then it will provide you a good support. मतलब if you see such kind of the wrong curvature, you can alter or you can advise such kind of this kind of the modification for the back support. Next is arm support. मतलब કે તમારો હાથને તમારે સપોર્ટ કરવાનો છે. તમારા હાથને તમે કઈ રીતે સપોર્ટ કરશો તો કે હાથને સપોર્ટ કરવા માટે તમારા એલ્બો અને શોલ્ડર એક લાઈન વર્ટિકલ લાઈનમાં હોવા જોઈએ. અહીંયા એલ્બો છે અહીંયા શોલ્ડર છે તો એક લાઈનમાં હોવો જોઈએ. ના કે તમારું શોલ્ડર એક સાઈડથી એલિવેટેડ હોવું જોઈએ ના કે તમારું શોલ્ડર એક સાઈડથી ડ્રોપ હોવું જોઈએ. તો તમારું આર્મ સપોર્ટ છે એ ન્યુટ્રલ રાખવા માટે તમારા બે શોલ્ડરને અલાઇન કરવાનું રહેશે. So like this way you can alter your arm rest. So if you don't have a adjustment in a chair, તમારી ચેરમાં adjustment knob નથી arm support set કરવા માટે, you can remove your arm rest or it is better to don't use arm rest rather than using a wrong posture. Next is a foot rest. Foot rest માટે while doing your computer work for a prolonged period of time, it is advisable to have your foot is in a neutral or the supported position. मतलब તમારું heel area and the toes area should be in a one line. First image માં you can see that તમારા foot પૂરા supported નથી. It is advisable to have a foot supported. For that, either you can adjust the seat height or you can keep the footrest additionally or modified footrest to compensate your seat height. So like this way you can adjust the footrest. Next is back support. તમારી back નું support કઈ રીતે હોવું જોઈએ તો કે your hip and knee should be in a one line. Hip અને knee એક લાઇનમાં હોવું જોઈએ. અગર તમારું back slant હશે આ રીતે તો hip અને knee એક લાઇનમાં નહીં આવે. Horizontal line ની વાત કરીએ તો hip અને knee should be in a one line. એ ના આવે તો that is a wrong posture for the back side. So next is a sit depth. Sit depth અગર વધારે હશે તો but obvious છે તમારે back support લેવા માટે વધારે lean થવું પડશે which is not good. So your seat depth should be in a length of your knee joint and hip joint horizontal distance. Measure a distance from the hip joint and the knee joint and set your seat depth. अगर વધારે seat depth હશે તો તમારા knee area પર એ compress કરશે. અગર ઓછી સીટ ડેપ્થ હશે તો શું થશે, તમારા ની એરિયાને કમ્પ્રેસ નહીં કરે પણ સપોર્ટ જ નહીં કરે. સો ઇટ શુડ હેવ અ આઈડિયલ સીટ ડેપ્થ. નેક્સ્ટ ઇઝ અ ટાઈપ ઓફ ધ ચેર. તમે જોયું હશે કે રોલિંગ એ રોકિંગ ચેર હોય. રિવોલ્વિંગ ચેર ઇઝ એડવાઇઝેબલ ટુ કવર યોર વર્ક સ્ટેશન. મતલબ ઓફિસ વર્કર છે તો ટેબલ પરનું બધું જ એરિયા તમારે ઇઝીલી કવર કરવા માટે ઇટ ઇઝ ગુડ ટુ હેવ અ રિવોલ્વિંગ ચેર. પણ અલોંગ વિથ ધેટ તમારું બેક સપોર્ટ રોકિંગ ના હોવું જોઈએ. ઇટ શુડ બી સ્ટેબલ. અગર સ્ટેબલ હશે then it will provide a stabilization to your back area and the hip area. So it is advisable to have a stable chair rather than the rocking chair. So this is all about the adjustment in the chair. We have discussed regarding the back support, we have discussed regarding the seat depth, we have discussed regarding the curvature which is present in the back support, we have discussed regarding the seat pan. Okay. So this is all about adjustment in a chair. Next parameter is keying. Placement of your keyboard and placement of your mouse. Keyboard ક્યાં રાખશો? સીટ અને કીબોર્ડ વચ્ચેનો આઈડિયલ ડિસ્ટન્સ કેટલું હોવું જોઈએ? અગર સીટ અને કીબોર્ડ ટેબલ વચ્ચેનો ડિસ્ટન્સ વધારે હશે તો the person has to lean forward to cover to reach up to your keyboard level. So for that, shoulder, elbow should be in one line vertically, and elbow and the wrist should be in a horizontal one line. मतलब 90 degree of your elbow joint angle. For that, it is the ideal keying position. Next is the mouse position. Mouse ની position ક્યાં હોય છે તો કે directly besides the keyboard. Mouse is ideally placed towards your handedness side. मतलब right side તમે right handed છો તો right side mouse place કરશો. પણ કયા level? Directly besides your keyboard. Next is the mouse position. The distance between the keyboard and the mouse is 10 centimeter, which is the ideal, and by this way which can prevent the musculoskeletal disorder, development of the musculoskeletal disorder. Keyboard position we can see in this image. अगर keyboard વધારે distance पर હશે तो person has to lean forward. So we need to keep in mind that our elbow joint should be in a 90 degree of angle. That is a shoulder and the elbow is in the erect position. Next, after the keyboard position, next is a monitor. Computer operator ની વાત કરી છે એટલે we need to have a table height, ideal table height, proper chair, height of the chair. Next is the position of the keyboard. Next is a monitor. તો monitor કયા angle પર હોવું જોઈએ? Monitor should be placed that person, your computer operator should be directly seated in front of the monitor. मतलब બે સાઈડ 30-35 ડિગ્રીનો એંગલ બને, સેન્ટરમાં એનું વિઝન રહે એ રીતે આપણે સેટ કરીશું, એન્ડ 60 ડિગ્રી ફ્રોમ ધ એંગલ. અધરવાઇઝ કેવું થશે, તમારું જો સ્ક્રીન આ રીતે નીચું હશે તો પર્સન હેઝ ટુ લીન ફોરવર્ડ ટુ સી ઇન અ મોનિટર. એટલે you can modify your monitor height by keeping the block beneath the computer screen. Like this way you can modify the screen. Next is if you want to read the document while doing the computer work, मतलब type करती वक्त you need to read some document or તમારે જોઈને કઈ type કરવું છે, it is advisable to keep your document besides your monitor screen rather than keeping the over the table. Table પર રાખશો તો શું થશે, વાંચતી વખતે you need to lean forward, and that require unnecessary movement of the neck, which is not advisable for your computer operator. Next is reading the document. If you keep your reading document or your document or the book over the table, you need to have a neck movement, additional neck movement. So for that, you can advise this posture. Organizing the workstation along with the chair, along with the table, along with the keyboard and the mouse position. For the office worker, they has to work over the telephone, they has to write something over the table, write over the page of the paper. So for that, according to the handedness, you need to keep your telephone over the right-handed and the left-handed person. Organizing the workstation, it is advisable to write in a straight sitting position rather than this leaning over the side, which requires unnecessary work contraction from the other group of the muscle. which is not advisable for the prevention of the musculoskeletal disorders. So like this way we can organizing the workstation. It is advisable to have your monitor screen and directly beneath your sit, मतलब chair. Chair ने तुम्हारे directly नीचे ज राखशु rather than keeping by the side. So by this way you can organizing your workstation according to one survey which is done at Hong Kong. Hong Kong માં 96 company માં 688 worker પર work કરવામાં આવ્યું and the results that because of this occupational illness, shoulder pain 42%, low back pain 39%, neck pain 39%, and upper back pain 36%. The prevalence of the shoulder, low back pain, neck pain, and upper back is common in a computer operator. They have a finger, forearm, and the elbow pain, but the chances of this such kind of the pain is the least compared to upper back pain and low back pain. It is my humble request to all the computer operators to take care about your shoulder, upper back pain, low back pain, and the neck pain. So, by changing your ergonomically correct work design, you can prevent such kind of the pain. For that, how we can provide a good ergonomically correct workstation. Along with the modification or along with the furniture setup, we need to provide a good temperature. હ્યુમિડ ટેમ્પરેચર છે તો એ બેલેન્સ કરવા માટે ટેમ્પરેચર કંટ્રોલ હોવું જોઈએ તમારું રૂમનું ટેમ્પરેચર અગર વધારે હશે તો ધેટ વિલ reduce your work efficiency. Along with that, overlight ના હોવું જોઈએ. Calm lighting should be there which will improve your work performance. And as I am a physiotherapist, I must include the exercise and the stretching. So exercise include eye palming. What is eye palming? While sitting over the chair, by keeping the elbow by the sides and put your both the palms over the eyes and rub over there. By this way we can promote the relaxation to our eyes, and by holding this 4 to 5 seconds and ask your computer operator to perform the deep breathing exercise, long inspiration and expiration. This will provide a relaxation with the continuous work stress. Next is a neck stretch position. How can we provide a neck stretch? By asking the person to tilt your neck, matlab touch your eye, ear towards your shoulder. Like this way I can stretch my right side of the structure and left side of the structure, vice versa commands. Next is a shoulder pinch exercise. Shoulder pinch exercise I will demonstrate. Ask the person to keep both the hands behind the head and try to touch your both the elbows. તમારા બે કોણીને ભેગા કરશું અને જેટલા વધારે બહાર લઈ જવાશે એટલા લઈ જશું. This is a shoulder pinch exercise. It is advisable to perform 2 to 3 times in each set. Next is a shoulder shrug. આ રીતે ખભા ઉપર કરશું, contraction hold કરશું 5 to 10 seconds, then relax. It will promote a relaxation to upper back area and the neck area of the muscles. Next is a very good exercise, that is a chair rotation stretch. How can we advise this chair rotation test? તો પર્સનને કહેવાનું કે તમારા રાઈટ હેન્ડથી લેફ્ટ સાઈડ chairને હોલ્ડ કરો. Like this way you can promote the stretching towards the right side of the structure and the left side of the structure. Maintain this stretch for the 5 to 10 seconds and repeat it with both the side. Next is the arm behind the back stretch. તમારા આર્મને પાછળની સાઈડ ક્લાસ્પ કરી દો અને શોલ્ડરને પાછળ ટ્રેક કરો, આગળ ટ્રેક કરો. This is a very common and very useful exercise to relieve the stress over the shoulder area. Next is a foot rotation. એન્કલને અપ કરશું, ડાઉન કરશું, inward rotate કરશું, outward rotate કરશું. Like this way you can give the exercise to your foot muscles. Next is a wrist flexion and extension. What is flexion and extension? Wrist means upward movement and downward movement. Wrist ને ઉપર કરશું, હોલ્ડ કરશું, સ્ટ્રેચ, રિલેક્સ કરશું, અગેન ડાઉનવર્ડ મૂવમેન્ટ કરશું, હોલ્ડ કરશું અને રિલેક્સ કરશું. You can see in this figure. Next is a finger massage. Overwork પછી but obvious છે, massage will definitely provide you relaxation. So it is advisable to have a relaxation with the massage. Gentle massage to your fingertips, whole length of the finger, palmar area and the dorsal area. Gentle massage with the simple cream or the talcum powder will provide you relaxation. Next is a finger squeeze exercise. Fingers ના રીતે હોલ્ડ કરવાની, squeeze करो, relax करो, squeeze करो, relax करो. This is a very good exercise for the relaxation of the wrist and the finger muscles. If you perform this all the exercise, it is advisable to perform all the set of this exercise every 2 to 3 hours in your work duration. That will definitely reduce your musculoskeletal disorders. In a According to one research, they have concluded that if you are having a low back pain and you are a computer operator, first check for your chair adjustment. તમારી chair proper adjust નહીં હોય તો that could be the reason behind your low back pain. હા, low back pain પાસે ઘણા બધા એના causes હોઈ શકે, but one of the cause could be your chair setup. તમારી chair ની height proper ના હોય અને table નીચું હોય તો you need to lean forward to compensate and to work for a prolonged period of the time. So low back pain, upper back pain છે તો chair adjustment કરી શકાય, keyboard ની height adjust કરી શકાય, monitor ની height adjust કરી શકાય. Same way for the neck pain. તમારું વર્ક સ્ટેશનને એડજસ્ટ કરવાનું થાય. અગર નેક પેઇન છે તો બની શકે કે તમે બહુ નીચે જોઈને વર્ક કરતા હોય, આઈધર તમે ઉપર જોઈને વર્ક કરતા હોય. So these are the common pain and these are the warning alarms to adjust your workstation according to your pain complaint. આઈ હોપ આજનું સેશનથી તમને થોડી હેલ્પ થઈ હશે અને મસ્ક્યુલોસ્કેલેટલ ડિસઓર્ડર્સ જે કોમ્પ્યુટર ઓપરેટરમાં 78% જેટલો ઓક્યુપેશનલ ઇલનેસમાંનો પાર્ટ કોમ્પ્યુટર ઓપરેટરને થાય છે, that we can reduce by certain group of the exercise along with changing or modifying our workstation, which we can say now we can use this terminology, that is ergonomically correct workstation. So ergonomically correct workstation ને ડિઝાઇન કરી plus exercise prescribe કરીને we can reduce our musculoskeletal, or we can say community based musculoskeletal disorder can be reduced. If you have any doubt regarding this session, you can write in a comment box, you can ask me directly. If you have any doubt, please mention your comments and the reviews in a comment box. I hope આજનું સેશનથી તમને થોડી ઘણી હેલ્પફુલ થઈ હશે. મને મારી કંઈ પણ ડાઉટ હોય તો તમે કમેન્ટ બોક્સમાં ડિસ્કસ કરી શકો છો. Thank you so much for Harivandana for providing me such a platform for presenting my session. Thank you so much once again to all the attendees for being present in my session.